away is gene therapy from becoming the cure to cystic fibrosis?
Gosh, Caitlin, that's a really that's a very interesting, quite a difficult question to start with. The UK Gene Therapy Consortium have made tremendous progress by making the normal gene that they've produced, making that more efficient, and that's been a tremendous piece of work over the past 10 years. But some of the underlying challenges that of gene therapy still remain, and really we'll have a much better picture once the what we call phase 2 studies, the exploratory studies, are undertaken over the next 2 or 3 years. If those studies go very well, then one would hope that this therapy will be taken on by a larger, for example, pharmaceutical company, and that we would move to more definitive, what we call phase 3 studies.
In what form would gene therapy treatment take, and how often would you have to use it?
It's most likely that the first gene therapy that will emerge will be an aerosolized treatment. By an aerosolized treatment, I mean that it's like a suspension, like a liquid. It goes into a machine that we call a nebulizer, and the nebulizer generates a mist, or we call that an aerosol. As time goes on, there may be different methods of delivering the gene therapy to different parts of the body, but in the first instance, aerosolized topical delivery will be the most likely mechanism.
Are there any risks involved?
There are always risks with any form of medication, particularly new medicines that have come along, and in the medical world we're very careful at monitoring any new therapies. So if a new drug comes along, we will always monitor how patients respond to it. And there is no drug in the world that is completely safe. So we always have to be careful as doctors and as CF teams about how we prescribe drugs. Whether there will be any specific risks related to gene therapy, I think that it's unlikely. There were some concerns about the impact that gene therapy might have on other parts of the body, and particularly with regard to people with cystic fibrosis who then want to subsequently go on and have children themselves. But I think those early concerns have not really come to fruition, and I don't think that is a significant risk.
What symptoms would it stop?
That's an interesting question, in that the symptoms, the aim of gene therapy in the first instance is going to be to target the airways, and obviously the symptoms that we're trying to arrest by using this therapy relate to the airways. So those are symptoms of cough and of shortness of breath in patients who are older and have more established airway problems. But really, the whole philosophy of what we're trying to do when we're looking at basic treatments to treat the underlying defect in cystic fibrosis is more preventative. So it's more about getting in there and preventing the airways from becoming infected and inflamed and damaged. So really, as physicians and as CF teams, we're very keen to have therapies that we can use at a very early stage as a preventative kind of measure.
If gene therapy isn't successful, what's next?
Well, I think it's important to say that that a tremendous amount has been learned from the work that scientists and clinicians have done on gene therapy for cystic fibrosis. So just really from the program of research that's gone on, we've learned a lot more about the condition cystic fibrosis, and that has opened up other avenues of potential therapies that may be useful in the future. And other research programs have looked at not gene therapy, but other very specific therapies to correct the underlying defect, the underlying genetic defect in cystic fibrosis. We wouldn't really call those therapies gene therapy, but we would call them molecular therapies, and there's quite a lot of exciting work that's just been reported over the last 2 years that suggests that such therapies are feasible.
Have there been previous trials? What did they involve, and how successful were they?
There have been quite a large number of trials of gene therapy agents. In America, most of those trials looked at using viruses as the agent to transport the gene into the cell, and they had mixed success, and certainly suggested that repeat dosing was possibly not going to be was probably not going to be possible with that reagent. In the UK, a number of trials have explored using liposomes, initially in the nose and then in the airways, and have suggested that that strategy, technique, may be useful for delivering the normal gene into the airways.
Have the trials been expensive?
In relative terms, no, not really, because a lot of the work that's been done on CF-related gene therapy has been undertaken by academics who are quite driven. So they're doing this as part of their academic work. So if you were to compare the development of cystic fibrosis gene therapy to, say, a pharmaceutical industry, a pharmaceutical company, a drug company who are developing a new drug, then the development costs thus far have been quite reasonable. Having said that, it's still a considerable amount of money has been invested, and the Cystic Fibrosis Trust, which is a large charity in the UK that supports research into cystic fibrosis, have invested a tremendous amount of money in the UK Gene Therapy Consortium and into the work that they're doing.
Is the future of the research dependent on money, and why?
Future of the research is most dependent on the results of the research and how effective it is looking, and if the planned study shows a very effective therapy, then there will be support to continue on the program. It is likely at this stage of the program that support will need to come from other resources, such as the government bodies that support medical research in this country, such as the MRC or Wellcome, or more likely from the pharmaceutical industry, from the drug industry, because the sums will be then quite considerable. But they'll be quite considerable because you'll be quite close to a potential therapy that can be implemented to people with cystic fibrosis.